everybody, it's Doc here at the Natural Health Center. So I think literally everybody waited until the last day to be seen, which was yesterday for this week, because we had so many call-ins and so many people who had upper respiratory infections and surprisingly not a lot of people who actually had sprains or strains or slips and falls, which is kind of what I was thinking everybody was going to have with this last week. So I want to talk to you guys a little bit today about the upper respiratory infections that have been going around. I answered so many questions about how to naturally handle colds and flus and those types of things, and what I do personally and what I recommend as a provider. So let's go ahead and talk a little bit about that. Now, there's some weird bug that's been going around, and it's staying around people usually 2 to 3 weeks. It starts in the sinuses and then starts to slowly go down. So the mucus in there starts to go from a white towards more of a green. So green typically means that we're getting some bacterial infections. Now, you have a couple of options for these things. One, getting adjusted. I know it sounds kind of weird when I'm saying getting adjusted is actually important, but I'm going to say getting adjusted when you're sick is actually one of the most important things to do. It's what I personally do, and it's what my entire family does. And I don't tell you guys this often because it's not something that I push on you guys, which is getting adjusted when you're not feeling in pain. As you know, we're treat and release, so people usually come into us with musculoskeletal pain. But traditionally speaking, I'm at what's called a straight chiropractor as far as philosophy goes. That means that literally every treatment that I go personally is straight to my chiropractor first, and then if my body can't fix itself, then I go on. Now that's me personally, so I don't push that on to you guys. But why is it that I get adjusted when I'm sick? We know, according to the most recent studies as well as anecdotal evidence, so what we've seen and what I've seen in my practice over the last almost 18 years now, is that when a person gets adjusted, particularly in their upper neck, it helps drain everything. It opens up the sinuses, and it also stimulates the immune system response for a more appropriate activity or activation. So, in other words, you get adjusted, and your amount of sickness actually goes down because your body's going to respond quicker. So we're basically just kind of giving it what it needs. Also, when people are coming in for like upper respiratory infections, what's the first thing that I'm going to tell you guys to do? If you guys have been adjusted with me, I'm going to open up those ribs. So we're going to be doing a lot of rib adjustments. We want to get some deep inhalation so that we can expel all that mucus. So one of the first things we always do is getting those ribs adjusted. Now, besides chiropractic, what else seems to help? Well, we do have quite a lot of patients who come in when they're sick and they need acupuncture, so that's another thing. Acupuncture does something similar. We're basically just kind of getting things rid of it or getting out of the way and letting the body do its job. So acupuncture is a huge, amazing thing if it tends to stay on, if it's not going away with other activities. So in other words, if you have a chronic infection, acupuncture works extremely well. IV therapies, if you're just can't deal with something, in other words, you'd be surprised how many people we actually have who fly in to see me and are here in Spokane Airport for 2 to 3 hours. They walk in my clinic and they want to get a quick IV because they know I do IVs here. But we do high dose vitamin C, which helps with antivirals, antibacterials, and helps with the immune system. We do that a lot. We co-manage a lot of cancer patients with that. But we also do ultraviolet blood irradiation, which basically I take some blood out of you, and I put ultraviolet A and ultraviolet C and ozone in there, and it uses and your own white blood cells actually use the dead buggies in there as a template, and it goes out and kills everything. So that's something that we also do quite a lot, actually. So those are the two IV therapies that we typically do for infections. Now, but what can you do at home? My go-to, and the thing that I was trained at from my master's degree when I did my master's degree in advanced practice for internal medicine, was actually elderberry. Elderberry has been a mainstay of my home activity since 2013 when I finished my master's programs. So elderberry works a lot like Tamiflu. If you get the flu, when I did my clinical medicine rotations, and in Chicago with the primary care doctors over there who were all trained at the University of Chicago, they would actually do rotations at UC and tell people to take elderberry for the flu because it actually works better than Tamiflu. So Tamiflu is a medication you guys can get that's prescription for the flu that reduces your symptoms by 1 day. That's it. It's 1 day. So you have to take this medication to get a reduction in symptoms for 1 day relief. So, but elderberry will actually take something that usually lasts 8 to 9 days and reduce it down to 3 to 4 days. And if you take it early enough, then it pretty much goes away within that day. And that's what I typically find here because I'm exposed to people being sick all the time. And I use the brand Sambucus. It's actually a spray that you can go right on the back of your throat. So I usually use that one. And also there's some pills that you can take as well. And then of course there's zinc that you also take for that. So elderberry and zinc are pretty much the ones that I love to take. The benefit of taking the Sambucus is that it also has echinacea in there. So if you're having viral infections, then it does tend to help with that. Golden seal is another one that is a great adjunct. If you're kind of getting that green goop, then golden seal is good. Doing nasal sprays. So you're taking a syringe and putting a little bit of salt water in there and actually squeezing it up into your sinus cavities and it will flush out the other side. It's called a nasal lavage. That works really good. Of course, using a humidifier oftentimes helps with that. Some Vicks under here if you're really bad. Or just sweating it out. Whenever I'm at home and I get sick at all, my family knows that I'm not feeling very well because I have a skull cap that I use, and so I'm wearing a skull cap, and then I've got my sick hoodie that I have on, and I put that sucker on, and I got my sick sweats on that I do that, and I'm downstairs in my guest bedroom, or I'm just vegetating, and I'm just kind of sweating it out. And sweating it out brings that internal temperature up to the point where it actually starts to burn off some of the buggies in there. So those are the things that I recommend, and those are the things that I do here at my office as well as the things that I do at home. The first thing, though, I can guarantee you is that when my kids are sick, the first thing they tell me is, "Dad, my neck is getting sick." That's exactly what they say. My neck is getting sick, and I'm adjusting it. So I know it sounds a little weird to you guys, but I'm not kidding. It works amazingly well. We have face masks in our office here to give you guys so you don't spread things everywhere. But even if you don't do the chiropractic stuff, I would highly recommend that you do the elderberry, the zinc, the echinacea, and if you need to, the golden seal. And sometimes you can find the mixtures. And the brand that I like is Sambucus. So that's my little piece for the day. And hopefully you guys have a great weekend. I'm going to go night skiing tonight. So you can guarantee that I'm going to have a good time. I'll see you guys soon.